Okay, so Hariom everyone. Today we'll go move towards the last disorders for endocrine and metabolic disorders, that is obesity. So, what is obesity? Obesity is a, as you all know that nowadays it is a very common disease for all the people, not only in urban areas but also in rural areas. Okay, so obesity is nothing but it is a medical condition. Though overweight people are also overweight, like their weight is overweight, or they have a little slightly like normal weight or underweight also. But when a condition leads to that much, like your body fat is leads to such condition or such level, it is termed as a disease, that is obesity. Okay, normally if a person is a little fat, it's okay, not like that he will have the obesity. So, obesity is a medical condition in which the excess body fat accumulates to extent that it may have an adverse effect on the health. I say na, if the person is showing this some adverse effect due to that fat or excess body accumulation, excess fat accumulation in the body, it will leads to obesity. Okay, which shows the problematic situation to body, leading to the reduced life expectancy and or increased health problems. And second, uh, and increase health problems. Some health problems it could reach. Okay, so like we are seeing in the diagram also that the person is having obesity. So we all are very much aware about that. This is not required for you. Still, matlab, I put this as what are the prevalence of this obesity for urban areas, peri-urban or slum areas, and rural areas. Okay, this is though not required. You can have see this data. Now, body mass index. There is something which is used to measure or which is used to evaluate whether the person is obese or not. How will evaluate? If the person is having a little high weight, he will set overweight, then obesity. Then obesities also have different grades. Okay, so to evaluate exactly as whether the person have a problem or whether the person have obesity as a disease, because it is a medical condition or not, we have to go through for body mass index, that is BMI. Okay, methods to evaluate body mass or your fat. A simple index of weight for the mass, that means weight upon height, weight for the height, weight upon height in height will be in meter square. Okay, so height will be in meter square. So that's why it is written a simple index for weight for height used to classify the overweight and obesity. Okay, or even underweight also. Okay, so BMI, this is the formula, weight in kg and height in meter square. It is given by WHO in 2012. Like this, it is there are some degrees we'll see in the next slide, that underweight, who is underweight, who will be the normal weight, extra excess weight, obesity, and extremely obesity. Further, it have the degrees of the obesity. So, classification of the weight and body mass. Okay, so and if the body mass, your BMI, that is kg upon meter square, will be less than 18.5, then it will be underweight. The person is underweight. Normal one is 18.5 to ranging from 18.5 to 24.9. If the person have 24.25 to 29.9, then person will be said that it is overweight. Okay, BMI if it have 25 to 29.9. If the person have greater than 30 BMI, the person will be said obese. Okay, but further the degrees of obesity is also there. If person ranging from 30 to 34.9, he will be called as obesity class 1 or obesity grade 1. It is also called as obesity grade 1. If 35 to 39.9, then it will be called as obesity class 2 or obesity grade 2. If more than 40, the person will be considered as obesity grade 3, the severe, most severe condition. Okay, this is the measure for obesity. Now, causes of the obesity, of course, our nowadays sedentary lifestyles, and we are not working like our our elders are working in their time. So we all are just having sitting works like IT sectors and all. We all are having sitting works. If we are going to college, we are just sitting there and coming back to home. We are studying there, though mental work is there, still no physical activities are more. Okay, then decrease physical activities, increase in fat intake. We are taking fat foods like fast food also, packet foods also, and more fried foods also. So this is and psychological problems again, as I told you, the mental related issues or manomay kosh is the main reason for all the problems. So therefore psychological problems can also lead to obesity because hormonal disbalance will be there definitely, so it will lead to show the adverse effect. Genetic effects, it could be genetic also. Manual jobs and are replaceable, like the jobs which we have done with our hands itself here before. Nowadays, it is done with all everything is done with machines. Okay, like before we used to see the that at our villages, our dadis and all put that atta chakki, huh? Then brings that atta and wheat flour. Okay, nowadays it is everything we are getting from the machines. Okay, now increase in the hours of activities, because we are sedentary activities are there, computer watching, etc., and no activities like physical activities. Therefore, no activity, endocrine diseases, genetic factor, and unhealthy food or lifestyle. Sedentary lifestyle. Now we'll move towards classification of the diabetes. Classification of obesity. These are types. Okay, so there are three types mainly described. That is android obesity, gynoid obesity, and mixed obesity. So as we are understanding from the word gynoid, it is something which is related. We can just understand to make us understand. It is something which is related to gynae or females, like gynecologist also there, gynecological problems are also there. So it will be something which is usually in the females and causing problems to them, though it is in all, could be in all the genders, but still more probably seen in. Okay, and android are mainly in the males, but still in females also we can see them. On and one is mixed will be definitely the mixture of both the above two. Okay, we'll see ahead what it exactly is. So this our android obesity, or word A, we can learn from the word A that it is apple shape. Also apple shape or android obesity, in which the person seems like, the body seems like a apple shape of apple. And then we have our pear shape, that is gynoid obesity is pear shaped obesity. Gynoid obesity, which in which the person will have shape like pears. Okay. Now we'll go one by one. Android obesity. What is android obesity? As I told you, that in android obesity, it is making the shape of apple. So apple, in apple form, what will be increased? Their stomach, their a little upper thigh region, and their chest region up till this hole will make a big bulge like structure which will form the shape like apple. Therefore it is called as apple obesity also. Okay, so therefore it is written in the word same thing. Apple obesity, also called as android or abdominal or central obesity. Why? Because in the central part of the body, upper thigh, just upper thigh, and the middle abdominal part, they are having obesity in this person also. Maybe pen is visible now. uh, in middle region, so people with high waist to hip ratios. Okay, waist to just hip ratio is called as are called as apples, or they are having apple obesity. Their body fat is distributed mainly in which region? Upper trunk, chest region, abdominal region, giving the typical apple shape to them. Okay, individuals are mostly males, though females could also have this problem, not like that only males will have, but mostly maximum males have. Okay, therefore it is in the diagram also, you can see android and gynoid. So we'll first move for android. In android, the abdominal, thoracic region, also their neck will be a little fatty more than a normal one. This metabolic syndrome and cardiovascular risk are more for them. So their mainly fat reasons are this. Very easy to understand. Maybe this hopefully this android obesity is clear to all. We'll move towards gynoid. Okay. Harium, everyone, my voice is
Yes,
audible.
yes, ma'am. Yes, it's
Okay, so gynoid obesity. Now, gynoid, as I told you in starting, it is related to a word female. So, mainly, usually, it is mostly in the females, though males could also have this, but very rare. Okay, it is also called as pear shape or peripheral obesity. Why peripheral? Because in the regions of periphery. So, mainly in the females, you have seen that lower region is a little heavy than upper one. Okay, they are also considered that they are obese, but their obesity is distributed in such a manner that it is mostly in the lower region. Okay, so body fat is distributed mainly in the lower trunk, hip, lower thigh, and giving pear shape to the body. Okay, mainly in the females, and males could also have. So this is, you can see in this female also, that the lower region is a little heavy. Hip, thigh means lower thigh, just little, upper thigh will be above it, and usually in the women. Very easy to understand. Yes. Now mixed obesity. What will be the mixed obesity? Of course, the mixture of something too. Before too, we have studied. So what it is there? They neither belongs to android or gynoid. They can't be, we can't belong to, because they are not only fatty from the lower region, not only completely fatty from upper region. Both they are having. Okay, so it is mixed. They have a barrel shape. Therefore, it is written whose body look like a barrel. Okay, and hinders the activity of the internal organs, because the body is that much, like from upper region also and lower region also, they have such a shape that body is feeling, and internal organs are not getting space for working properly. Okay, symptoms of hopefully these all three are clear. Classification or types of obesity.
yes, ma'am.
Yes, so symptoms of obesity now, very common symptoms like large body frame, flabby fat in upper arms and thigh region, or also can have the sometimes you can see there they have double chin and all. Okay, and lethargy, of course, their body will, they will not be able to uh, uphold their body weight. Also, they have those at these problems like knee pain, of course, because their body is that much heavy and they can't uphold this that much weight for the knees. Okay, so then breathlessness, of course, high belly fat, then your early puberty, increased sweating, snoring, because they are not getting proper oxygen because of that fat, that much fat. Okay, very difficult. No? Excessive sweating, double chin, as I told before, excess fat deposition, abdomen or waist region, breathlessness, very common symptoms you can give by yourself. Okay, feeling tired after doing a little physical activities, not more. Okay, continued for that only, your symptoms only, fatigue and little physical activity, back and the joint pains, as I told before, and then lack of enthusiasm, lack of self-esteem, though they also have lack of self-confidence. Okay, very important point you can write by yourself. They have very less self-confidence, because they feel that everyone will seeing them. They feel that whether I am looking good or not, they're concerned about all that things. Okay, whether others will not make, whether others will make the fun of me and all, like that. So they are very low confidence also. Okay, lack of confidence is there for them, feeling of isolated in society. They feel that these are other people and I am a little isolated because I am a little different frame of my body. Okay, and depression also. Now, health problems associated with obesity, though not required that much still, as we have seen in all the problems, that obesity is also one of the reason, and they problems can also lead for obesity. Okay, so they are interlinked with each other. You can see that other these all diseases could happen. Okay, not much. These are also, this I kept like greater risk of having these problems, greater risk of having these, and then moderately risk of having these problems, and slightly very less risk of all this. Okay, not required for more. Now, one second, just these are the medical problems leading to obesity, damage in your hypothalamus, etc., etc. And now this, these are the medical management. This is not that way. Okay, medications and damage to hypothalamus, arthritis, and other more problems are there. So different approaches. There's some medicines. Many medicines are there. They people used to take for obesity, but one of them I named. And further, the management, we have surgeries. Okay, surgeries. So in surgeries, what is there? So one is called as bariatric surgery. Okay, bariatric surgery have two things, two like aspects. What? Gastric bypass and sleeve gastrectomy. Okay. So in sleeve gastrectomy, what they used to do, like this is our abdomen, this is our interior part, this is our external part of the abdomen person. So they removes this internal, this outer part of the, therefore the portion of the stomach is removed. They used to remove this portion. Okay, this is, they remove, they cut this portion and remove this portion. Okay, and then join everything same, and everything is working properly. But these are not very, we should not go for them. Okay, that I'm saying. So what will happen, this will be removed, this all outer part will be removed, then they can have normal lifestyle. Okay, now we have this gastric bypass. In gastric bypass, as the word bypass, we also use the same word bypass where, in which management, can anyone?
Heart, heart
Yes,
bypass.
very good. So bypass has told you to travel something like displacement. Instead of traveling like this, we used to go for displacement. Okay, so in this gastric bypass, what they do, like instead of going anything into the stomach, they directly, what they do, a pouch like structure is there, and they directly travel it out so that the abdomen will not get that fat. Okay, like this. See, they directly put it outside, so that they will not get fat. So abdomen will be rid of that. And then liposuction, lipo word is something which is for lipids. Okay, so some this instrument like structure is there, for from that, from your tissues or cells, they remove this yellow color, is yellow color is for lipids. Okay, so they remove these adipose tissues, lipids, and etc. from your body. Therefore it is liposuction, suck that out, which will decrease your body weight and make you slim. Okay, before and after. It is not required. Still, very good. We should know this. Okay. Then this is management is going on. There's medicines, then surgery, then Ayurvedic management. We have to give them this one, your panchkarma, panchkarma treatment. Have to give them, and then udvartana. This is nothing but outer massage. Also, we used to give them dry faction. Okay, dry faction. Okay, dry fraction we used to give them. For in dry fraction, what they used to do in normal, like as they are going for the bath, before that their body is dry, they should keep one towel or anything, and then can they should rub their body. All the extra dead cells, dead muscles also like get released. You should go for dry section, dry fraction. Okay, it is not written here. You can write by yourself. Naturopathy treatment, weight reducing diet,
What is it, ma'am? Dry
dry faction,
action. Spell it
dry,
out, ma'am.
DRY, dry
Yeah.
faction, 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 dry faction.
You mean rub with the towel?
Yes, yes, scrub with the towel, extra all the dead, dead cells and all will removed. It is said that for the this one we should go for it. Obesity. Now naturopathic treatment,
Ma'am,
same way.
is there a term in Ayurveda for that? Uh, this dry thing, ma'am? Dry action. Is that an Ayurvedic treatment?
Yeah, you cannot, like in Ayurveda we used to give them these five principles like this panchakarma, but no,
Yeah,
uh,
the dry faction I'm talking about. Is
yes,
that an
diet
Ayurvedic
is
treatment?
not exactly the treatment, but a little cure they used to tell. Okay, like that.
What do they do? They rub the body with a dry
Just
towel.
no, normal, just like we are going to the bathroom for taking bath. Okay, so we'll go there, and after removing all the clothes, we'll rub our body with the a little scrubby type of our towel only. Okay, hand towel like that. Okay, that only. All the dead muscles, dead cells also removed by that. Okay, that is very good practice. We should do.
Yes,
And
please.
then Then naturopathy treatment. This one your is one second. Fasting. Fasting is very good therapy. So as you all have studied Ayurveda.
Not yet, ma'am.
Yes or no? No.
No, not from
Not
MDYA.
yet, ma'am.
Okay. So fasting. You know that fasting is related with which panchkosha?
With
Sorry,
air,
which panch? Yes, which
with
yes,
air element.
yes,
Ether.
very. No, not air. It is Akash. Okay, because Akash Tattva is something which is related to your hollowness. Okay, so fasting is very good therapy for all the diseases. Okay, so or obesity, of course. Then sauna bath. Sauna bath is nothing but it is a place. Okay, it is a room which. We kept the person in the room in a place which is designed in such a manner that they will experience a hot steams. Okay, used to give them hot steam, and by this, because I also went for the naturopathy treatment once for 10 days. So there we used to take what, so there they used to
Like
give
the
us
stream bath, ma'am.
what.
It's like stream bath.
Yes, it's like a steam bath. So, same. Okay, like steam bath. Then they will have the sweating and all, and all the fat will be removed slowly, slowly. One thing also in naturopathy, we used to give them sun bath. Okay, sun bath. I used to take one plastic polythene is there. We used to put remove the clothes and put that polythene there, and stay there for some time and put a little cold normal water towel on the head so that head will not get warm. Okay, in sun used to sit and all the like sweating. So if regularly we do the practice, the person will get lean. Then massage is very important. Now balanced diet, whole cereals, legumes, that this is okay. Obvious also, no packet foods and all, avoiding also, you should know fruits, cooked vegetables, even they should have the raw vegetables, greeny leafy vegetables, raw vegetables, oils, and they should go for this one unsaturated fats. Okay, like polyunsaturated fatty acid, PUFA and unsaturated. No. So instead of saturated, they should go for uh, unsaturated fats. So avoid deep fried. This is very normal. Deep fried, processed food, bakery foods, packed foods. Do not watch TV while eating because our whole brain will go to the TV, and we don't know how much we are eating. Okay, and always we should, before eating, they should go for, like, instead of with chapati. Okay, instead of taking with chapati. Taking salad with chapati, they should eat salad first, after that go for the chapatis. Okay, and in sorry, before eat raw vegetables or salad, whatever they want to eat, after that they should go for a like a bowl of one or two bowl of full of vegetables, normal cooked vegetable what they are going to eat, further then go for chapati. Then you will see that they will be able to eat only one chapati, or if they are eating four chapati, they will able to eat only two chapatis. Okay, so this is how they can decrease their amount of carbohydrates. Okay, avoid alcohol and smoking, coffee, meat, etc. You all know about that. Yogic management. So in endocrine disorders, in first also I uh, on first day what we have studied diabetes mellitus. There also I gave you yogic management. Yesterday only we didn't do for hypothalamus and all. Okay, sorry. Hypothalamus. So for that also, are all the bronchial asthma thing will be related to that. So yogic management for bronchial asthma could affect for hyper and hypothyroidism. Okay, so you can take it as same in this one. Our obesity we are seeing now. Okay, yogic management for obesity. Diet we have seen before slides, two slides, and simple sattvic food. Asanas, dynamic, all the practices. Okay, so for different, like put for the I have put here for the different sites, like for abdominal obesity we used to give them abdominal practices. Okay, like if you all people know that Tan Padasana, raising your legs to 90 degree, 30 degree, 60 degree, 45 degree. Dhanurasana, again their abdomen will be affected. Bhujangasana and fast Bhujangasana, Turek Bhujangasana also there. Paschimuttanasana is especially in, if you will see in Hatha Pradipika, Paschimuttanam, as one stroke is there for Paschimuttanasana. The special benefit is given that abdominal fat is decreased. Okay, then Padhastasana again, Ushtasana, many practices you all know, Ardha Matsyendrasana, wherever abdomen is pressing or affected, we should go for all those practices. All cycling, Padvritasana, and Dvichakrikasana, everything should be done. Okay, many asana, but it is written very less. I named more. Peripheral obesity. Peripheral obesity is what it is also called as
Ear
or
shape
yes,
problem.
pear shape obesity. Okay, for pear shape obesity, lower region part, lower region and practices we have to go for like Trikonasana, Parivritta Trikonasana, oh, Veerasana, Setubandhasana. Okay, 1 second, please. 2 minutes, everyone, just wait. Just wait for 2 minutes. Okay, my voice is audible now.
Yes, ma'am.
No. So peripheral obesity we have done. Now as we have done here, Annamaya Kosha, and move towards Pranamaya Kosha. So for Pranamaya Kosha, we'll go for all like Surya Bhedi Pranayam. Some things are not written here that you have to, because lots of things are there. How much I will write, you know? So you all are very trained also. Surya Namaskar in Annamaya Kosha, they also go for Surya Namaskar. Okay, regular practice of Surya Namaskar. In pranayam, Surya Anulom Vilom, Surya Anulom Vilom, and Surya Vidhi. Okay, what is Surya Anulom Vilom? If you all don't know, should know, but if you don't know, so in Surya Anulom Vilom, we used to take breathe in and breathe out only from the right nostril. And Surya Bhedi is breathe in from the right nostril and exhale from left nostril. That is Surya Bhedi. This is Surya Anulom Vilom, only breathing in and breathing out through right nostril. Okay. Now Bhastrika Pranayam also, and we didn't see Kriya here. Okay, Kriya we didn't saw. So Kriya in Kapalbhati will give them Mamandwati, Lagu Shank Prakshalan. Even within 6 months, we can give them this one, Poon Shank Prakshalan. Okay. Now Ujjayi Pranayam, because Ujjayi Pranayam will of course the effect for that, for even thyroid and everything. In sectional breathing I told you before also, in Vibhagya Pranayam, in Hindi it is called as Vibhagya Pranayam. So in this abdominal breathing, thoracic breathing and clavicular breathing, all is there. Then Manomaya Kosha will have meditations, all type of meditations, sitting straight and having like concentration on your breath and all, home meditation, etc. All we can give them. Also lectures and all in Vigyanmaya Kosha lectures, and the will make them understand about their problem, how they can heal the problem. Mostly the people with obesity are a little depressed because they have like isolated feeling of isolation, and also lack of confidence and not confident about their body and even themselves, though they are much talented, if they are even much talented. Then so we'll give them lectures and counseling, yogic counseling. Then yes, yoga can affect your body. Satsang, and then awareness programs about their disease and healing of their disease. Anandmay Kosh, again same, happy assembly. We can have the games with them, running games, football and all. We used to play with them in Esvesa. So it is very good. They feel happy also, and they're also getting benefited with this. And then Karma Yoga practices. With this, thank you so much, everyone. If any doubts, you can ask. Otherwise, I have completed this disease and management. With this, our endocrine disorders and metabolic disorders are completed. Any doubts?
Ma'am, can you go to the slide on which you have presented health problems associated with obesity? Yeah, this one. I'm making a note, ma'am. Can you hold on here for a few
Yes,
seconds?
yes, ma'am, of course. This dyslipidemia, if like everything is clear to all, I hope so. But still, if dyslipidemia you are not understanding, it means that when there is when there is something like abnormal elevated cholesterol type of or fat deposition, or we can say lipid or adipose tissues in the blood. Okay, because this dyslipidemia also because the word itself is giving lipidemia. Okay, this is nothing but abnormal cholesterol deposition or lipid fat deposition in the blood.
The next slide, ma'am.
Everyone know about sleep apnea?
Yeah, we were taught, ma'am, in psychology.
Okay, very good. Okay, so you can have see from the slides.
Yeah.
Okay, though if these health problems are not that much required. Okay, I told you that what is required for exactly. So mm, now everything in today's class is okay for all.
Ma'am.
Anita ma'am, okay.
Yes, ma'am.
Any doubts? Left. Very good. Then Sonia ma'am, any doubts? Aarti ma'am.
Ma'am, can you hear me?
Yes,
It's
yes, ma'am.
okay for me, ma'am.
Yes, ma'am. Yes. Okay. Rajdeep sir, any doubts?
No, ma'am.
Okay. So, will we end this session or should I ask questions for 10 minutes?
It's left to you, ma'am. Depends on your time.
No, if you people are completely. Tomorrow, I will let you know that class will be there or not. Uh, hopefully, because I have to go somewhere.
One question, because you have attempted the NET exam and qualified in that. How long would the Upanishads, Mukhya Upanishads, and also the Yoga Upanishads take?
Like how many questions or weightage?
Not questions, like to be taught, that subject to be taught. How
Okay.
many sessions would it take?
Ma'am, actually, like